So today, I'm really looking forward to today's discussion. We've been noticing for some time now that there's an emerging trend where people who are interested in making significant change and the people in the communities where they live are doing this in ways that are not like programs and projects. They're really making investments to whole networks of players and organizations that are oriented around establishing vital conditions that have never really been in place for everybody to thrive together. And so today's program is going to spotlight a couple of these stories um, while we all pay attention to this rising trend across the field. Next slide. Just a word about these webinars. We try to make them as engaging and interesting as possible. If you see ideas for future sessions, we're always interested. It's just a chance to ask some in-depth questions to change makers in different situations, but we all can learn from each other and our experiences, so we can gain actionable insights and hear both about the progress, but also about the challenges that folks face. So you're in the right place, no matter whether you're new to this or a veteran who's been at this work for a long time. I'm joined by really terrific colleagues who we've admired and in some cases been learning from for many years, as well as some new colleagues who's bringing their perspectives to this work, and it's fascinating. So we're going to spotlight two places: Contra, Costa, California. We'll hear from Duffy Newman and Marivel Mendoza-Matheu, and then all the way over to Cincinnati, where Ashlee Young and Caitlin Bentley-Thayer have stories to tell about their work in greater Cincinnati. I'm Bobby Milstein. I'll just do a little bit of stage setting as we get going, and then you'll hear plenty from these two teams. Next slide. This map, in some ways, it's just a reminder that when we look at specific stories, it can feel idiosyncratic or very special to those places. But what we see, looking across the country, when we look for signs of people turning toward each other who are sort of curious for better ways to thrive together amidst all the chaos and cruelty that it seems to be mounting by the day, there are more and more people who have sort of dissatisfied with the status quo and are looking for ways to escape that doom loop and make significant strides toward equitable well-being. And this rising movement to thrive together is really taking shape in communities all across the country. When I look at this map and I think about our theme today of investing in vital conditions, making those grants to people who have never been seen as investable themselves. Be Well Palm Beach County has made mini grants to neighbors for I don't know how many years, 6 years now or more. And the stories of what those residents and their neighbors are doing when they're receiving these grants for expanding vital conditions, building belonging civic muscle, it's totally impressive. Thriving Together Forsyth has had in Winston-Salem, North Carolina, has had a well-being portfolio structure in place that's bringing new kinds of ideas together into a cohesive portfolio that's driven by the residents and the organizations that call that place home. And Healthy Communities Delaware likewise has had statewide investments in neighborhoods and whole communities across the state, dozens of them that see themselves as stewards in the future of Delaware and their own place within it. Inland Empire, all the way on the West Coast in California, has had a specific investment in teams that are focusing on belonging and civic muscle. So they are sort of opening spaces for people to spend time and energy and resources in ways that historically haven't. I'll just end with a quick story. Last week, I was in Pennsylvania meeting with colleagues from the Buell Foundation who have a youth scholarship program where the question that all youth answer is, which vital condition would matters most to you and how would you make change in that area? And one of the youth scholarship entries inspired them so much that they created an RFP program based on that young person's idea, and it became the basis of their next cycle of grant making. So the field is maturing in ways that are really, really impressive. Next slide. Beneath all of these stories is really a rising ethos behind it, this aspiration of thriving together. We're not going to shrink from our ambitions. People who really say, we know what it is to struggle and suffer, and that doesn't have to be. We can move decisively toward a future where all people and places are thriving together, no exceptions. That aspiration gets a lot more serious when it's paired with the next layer on like establishing the conditions that are needed to thrive. We've had webinars and there's other resources around what these vital conditions are. I'm guessing a lot of people here may be familiar with those, but if you aren't, it's a way of being very concrete about if we want people, we want to live in communities that are like stack the deck in favor of people thriving, we have to establish the conditions that are in place for everybody, especially those that are struggling and suffering. This vital condition structure helps lots of people from different walks of life organize around that. And of course, belonging and civic muscle at the center, which is both a vital condition, but it's also the thing that that is a practical capacity, allows us to bring even more connections and contributions and culture and creativity into this work. So the more we expand belonging, the deeper our civic muscle to be able to do things we could never do alone. That vital condition structure gets even more significant when we see it as a whole portfolio. And it's one more click, you'll see this diagram marries the vital conditions on one side with the urgent services that any of us might need temporarily in a crisis. And those are important things to invest in. They're life-saving, they're life-altering, but there's no amount of urgent services that can produce the experience of thriving. That has to come from investments in these vital conditions. And so when we think about these whole portfolios and the kinds of grants that we can make to make significant moves toward a thriving future, this structure gets a lot more concrete. And of course, when we think about who are the people who are capable of making these changes, it's not just a few leaders who happen to run institutions or organize around their issue areas. All of us can be stewards of the things that we care about. We can connect across difference, create opportunities where they don't exist now, and most importantly, learn and adapt. So we're not just making a change and hoping that that program is going to pay off, but we're constantly learning and adapting as more and more people engage in this work, and we discover what it takes to make moves and how to be relentless in our pursuit of well-being, even when the headwinds are blowing against us. So this ethos is really a hallmark of what we see across the nation as more and more people are rising into this moment. And another pattern that we're starting to see is that there is no better time than the present to be able to make major moves toward thriving together. Just imagine a decade from now celebrating a 20-point move toward thriving together. I love this quote from one of our colleagues who said, it's a great stride goal that is aspirational. Maybe it's bordering on impossible, but it's what's needed right now. This is how we escape the doom loop and concentrate on making the moves that we know are capable of making. And so we could see that kind of change even within the next decade. If you're a visual person, you can see that the story by the numbers on the next slide. These are real. These are national numbers of the fraction of the U.S. adults that were thriving. That would hit its high point around 60% in 2021, just as we were coming out of the pandemic. And it has dropped 11 points in just the last 5 years. So we are in the midst of a slide that has every reason to think it can continue. There's financial insecurity. More and more people don't see a way to make change. They don't believe that it's possible, or they certainly don't think that they have any role in it. So that ongoing slide is really worrisome, but it's not destiny. There's another path that's open to us, and it would look something like this. We're oriented toward the North Star of all people and places thriving together, but we can make real, significant moves. They may not happen instantly, but as more and more of us turn toward each other and build that belonging civic muscle that's capable of making change where it isn't happening now, this movement can gain even more momentum. And so that path, the difference between the two, one more click, it depends entirely on how we invest. A better balanced portfolio across these major influences can make the difference between whether our future looks like one of deepening sort of adversity and crisis, or one that we begin to turn that crisis into long overdue healing and renewal and the expression of what it means to really have solidarity for all people in places thriving. So this 20-point goal is not just a big number, right? We actually know a lot about what it takes to propel changes of that magnitude, and it's entirely about how we invest. How we take our resources now and invest them in ways that even build those resources even more, flip the script on scarcity and say, when we invest in belonging civic muscle, we all get bigger, more connected, more of us can contribute. That allows us to be able to make moves on vital conditions. It lets us set up systems that are fair by design. And importantly, it lets us not over rely on urgent services, which again are needed, but they're not a strategy for thriving. And so we can't over rely on something that can never deliver the thing we hope for. And that brings us to today's story. We've got two groups who are doing some really impressive things to invest their resources into the hands of change makers who are capable of propelling the kind of strides that we're talking about here. So enough from me at the moment. I'm going to turn to Duffy Newman and Marivel Mendoza-Matheu to tell the story of what's going on in Contra Costa.
Great. Hi, everybody. You can go on and move to the next slide. I'm Duffy Newman. I'm delighted to be here and excited to share our story and continue to learn from everyone else. I'm the co-executive director of the Contra Costa Regional Health Foundation, where we're committed to advancing the public's health and health equity across Contra Costa in partnership with our public health system. We invest in the vital conditions all people need to thrive by convening cross-sector partners and building the infrastructure that helps communities and systems thrive together. I am looking forward to bringing it down to the ground level and share more of the work that's actually happening in Contra Costa together. Next slide. Just some of you may not know where we are. Contra Costa is located in the East Bay of California, across the water from San Francisco. We've got about 1.2 million people. There's no single racial or ethnic majority in our county. On paper, we look affluent with an average income over $127,000, but that hides the real divide. 4 of the 10 poorest cities in the Bay Area are here in our county, alongside some of the lowest poverty rates in the region. That contrast is really the reason that this work exists. And next slide, please. It's really, as I mentioned, a place of contrast, but also a whole lot of heart. These photos can certainly speak for themselves and the work that's going on. Next slide. Sorry, this is my thing. Thanks. So the work of Contra Costa Together that I'm going to tell you more about grew out of an initiative called CACHI, which is the California Accountable Communities for Health Initiative. That's a mouthful. And our foundation became the backbone for that work. And it really changed some of our thinking as well. And in 2025, our board formally adopted the vital conditions as our organizing framework for all of the foundation's grant-making partnerships foundation-wide. Next slide, please. Contra Costa Together is the vehicle by which we're doing this, the container by which we're doing a lot of this work. The stewards who lead this work together did not want to build another short-term project. They're building something with a different architecture for how the county understands and responds to residents' well-being. That's grounded locally and with shared accountability across institutions, really around building a network of networks and something we see as a regional asset. Next slide, please. So how do we create change together across our county? This is really our theory of change, and it means that a stewardship team, which includes community leaders and when we convene, and residents, systems, and county government, as well as philanthropy. And we're at the same table, and we're working to build using data alongside lived experience. We don't see leadership being centralized. It's distributed across the network. Next slide, please. This is who makes the work real. These are 18 community-rooted organizations from arts and early childhood to farm worker advocacy. And one of those organizations that are grantees of the Contra Costa Together via the foundation work is Hijas Del Campo and my colleague Marivel, who is going to tell you all about the program that and the work and how that's unfolding in the community. So,
Yeah. Thank you so much, Duffy. Thank you so much. We're so happy and grateful to be in the space with everybody. So I am one of the lucky ones that have been able to sit at the table and to be a steward. So I am coming into the space wearing both hats, both as a grantee, an organization, and also a steward who gets the opportunity to really dream about how we are making these vital conditions actually work for our community. So Hijas del Campo is a nonprofit organization that works with the farm workers in the region. And like Duffy mentioned, right, Contra Costa is a very expansive space. And we are seeing everything from really urban areas, city areas, all the way through to our agriculture regions, where sometimes people don't even realize that is farmland in Contra Costa. Next slide, please. And so when we started at a time, our organization was 2020, when we were really looking at the pandemic and how this was affecting our community. And from the start, we said, how are we really going to protect our community? How are we going to take care of them in a really holistic way? We understood that our farm workers, it wasn't just about workers' rights, but it was everything that encompassed their well-being. And so being a part of the stewardship team has really, it was a no-brainer, right? We're looking at the vital conditions, what our communities need to thrive. And this is exactly something that was able to really talk about our farm worker experience and how we wanted to create this belonging. Next slide, please. One of the ways that we wanted to do that is us as leaders and as community members, we also wanted to make sure that we were creating a space where our farm workers' voices were front and center. So not just myself or my co-founder, Dorina, we are first generation Mexicanas. Our parents came to this country and their first jobs were as farm workers. And so when we're looking at our farm workers here in the region, we're looking at our families, we're looking at our parents, at our uncles, our aunts. And so we're saying, how do we give them the voices? How do I want my mom to come to these spaces to speak up? And what do we need to do that? And so part of the work is through our committee, and it's our farm worker committee, and it's the first of its kind. And actually, we haven't had an organization that has been specifically focused on farm workers here in the region. And that's because of the power dynamics, who is in control. And so this is why Contra Costa Together coming and bringing all of these stakeholders to the table to meet the moment is so crucial and so important, because we're saying, who has the power and how do we disperse that in a way where everybody is taken care of? And so we did that through the Comité de Campesinos, where we're actually uplifting them and their voices, but we're also helping them envision and really look at themselves in this broader picture, not just them, their issues, but how does this also affect the community around them, our neighbors and our community members. So next slide. What does success look like? So this is really making sure, like I mentioned before, that their voices are being heard, that the movements that we are making is really with what is meeting the moment right now. We understand that this moment is one like we've never lived before. I mean, just this morning, we are living through the Supreme Court having a decision on birthright citizenship, right? So we have to be agile. We have to be moving with the moment and moving with the decision decisions that our farm workers really want, right? This isn't what maybe the conversation that we had 5 months ago is something, it's changing where we are right now. And so those are some of the basis of how we've had to move. Next slide, please. And as you can see here, this is pretty much how we're taking those vital conditions and we're actually approaching it with our holistic model. And so where in all of that, we're looking at workforce development, we're looking at food security, we're looking at housing, education, and healthcare. One of the things that we have been really grateful for and is also working with the Department of Public Health here in Contra Costa, who is having their community health assessment. Being at those tables and having the vital conditions framework has been incredibly important because we are having these surveys done in a way that is being cognizant and thoughtful of what does belonging really mean in a time where belonging is something that is being stripped away from our communities, where people are telling us that we do not belong. And so when we're looking at systems like the public health department, actually taking into consideration our lived experiences, what does it look like when HR1 is impacting our healthcare, that we can actually look back at this framework to actually make effective change. So it's happening at a level where we're working with community, it's happening at a level where we're partnering with public health systems, and we're also learning from each other. And other organizations. I mean, Duffy highlighted the amazing grantees. And so how we're partnering with them and teaching, our communities, it's not just our issue. This isn't an isolated thing. How we can uplift each other in these spaces. So I probably have gone over time, but these are just some incredible things that are happening at a county level. And I do also want to say that when we're looking at how we're grant making, part of that grant is also resourcing our farm workers who are a part of this committee. Their time is important. It is valuable. And so a part of those funds did actually go back and is going back to a stipend to our community members. And so we're incredibly grateful for that because their time, their expertise, time away from their family is really important to resource. And that's also a part of what we're doing. So.
That's
Yeah.
beautiful. Thank you both. I hope everybody in the audience is feeling what we were feeling when we saw this work, is that it's setting a new standard for what it means to make investments that are humane and are capable of catalyzing change, even in a time that of great adversity. Ashlee and Caitlin, tell us the story of what's going on in the Rural Changemakers work.
Yes, so good afternoon. My name is Ashlee Young. I'm our Vice President of Strategic Partnerships at Interact for Health, and joined by Caitlin. And so just wanted to share a little bit just about Interact for Health and really contextualize our work a bit. We have really enjoyed working with Ripple, and really enjoying the vital conditions, and really has given us a different language to use that really resonates with a lot of folks within our community. And so we have our question here of what does a thriving community look like? And this is something that continues to just ground our work, and really believing in the notion that when people feel like they have this sense of belonging and have the ability to make change, those things are really driving what it looks like to have a thriving community. And here are pictures from our communities of people living their best lives. And this is just a reminder again, the work can seem hard and daunting sometimes, but just a constant reminder of like what we're working towards within our community. The next slide, please. At Interact for Health, we are really focused in on improving mental health and well-being for youth, and also investing in initiatives that allow community to lead and decide what's best. At the end of the day, the foundation of both of our focus areas of our work is really around advancing policies and systems change to promote health and really undo unfair and unjust policies that undermine health and well-being within our community. Here we have our priority populations that we are intentional about focusing in on around our efforts. And I didn't mention too, so we're a health conversion foundation that is located in Cincinnati. And next slide. So we're located in Cincinnati in Hamilton County. However, we cover three states, Ohio, Kentucky, and Indiana. So our footprint is it is 20 counties. And within those 20 counties is about 2.4 million people. Next slide, please. And so we launched our current strategic plan, I believe in 2023. And one of the things that we realized during that strategic plan is when we look back at our investments, a huge area of opportunity was an investment in our rural counties. And so you can see here, 14 of our 20 counties are actually rural. And so with seeing that we needed to have this intentional investment, we hired Caitlin on to help build out this strategy. And Caitlin is phenomenal. And so you all should definitely reach out to her. I tell her often, it's not often that she's just very strategic and very committed to the work and committed to real change and shifts in power. And so I feel truly blessed every single day to be working with her because she's just super smart and really super committed to the work. And so we launched our rural investment strategy. And so with our rural investment strategy, we are focusing in on we can go to the next slide real quick, our councils, event sponsorships, and our Rural Changemaker grant. And so to date, and leading up to the end of this investment strategy, so from 2024 to 2027, we will have invested a little over $3 million in this rural investment strategy. And I will say what has been a game changer and which we'll spend a lot of time talking about today is the language that we've been able to use around vital conditions. And so we adopted that language as part of our language as an organization, have just been on this journey of trying to be more intentional around it. And what we found in our rural communities is that using the language of vital conditions and making the distinction between vital conditions and urgent services, it gives language to the work. Whereas before, when we talk about everything all together, it has been hard to make those distinctions between upstream and more downstream strategies. And so we were really excited to have this language and really be on the journey with our rural council and our investment strategy. I'll let Caitlin make a couple comments, and then I know we'll jump right into the fireside chat.
Thank you so much, Ashlee. I kind of want to pick up where Ashlee was leading us about some of the language change that the vital conditions have allowed us to kind of lead the way with, because the philosophy that we've sort of led with is that some of that baseline change is helping us lead the way to broader cultural change and broader cultural shifts all throughout our rural region. So as you can see here, our rural investment strategy is kind of like a three-pronged approach. The rural community councils are a huge part of the Rural Changemaker grant, which is kind of our signature, I guess, kind of showpiece when it comes to our investment strategy, because the councils review and score and kind of are the decision makers behind a lot of our investments in our rural region. When we adopted the framework of the vital conditions with our Rural Changemaker grant, we weren't necessarily sure how our rural communities would respond at first, because the first year of Rural Changemaker, we put it to the community and we just said, hey, y'all, tell us kind of what y'all need. And it was very open and very broad. The second year, we used the vital conditions as our framework. We weren't necessarily sure how folks would respond at first. It was very new. We introduced a lot of webinars. We introduced a lot of teaching tools. We had what were called rural connections and rural receptions that were kind of like networking opportunities where we came out to the community and kind of assisted folks in this learning process. Some of the pictures that we had there at the beginning on that first slide were from those. We really wanted to help kind of be hand in hand with folks as we were learning along the way. What happened was that instead of folks kind of being confused about this, is that folks rose to the occasion and were really very excited. Folks kind of saw the need for a broader systems movement shift to something not necessarily replacing the urgent services, but sort of like a yes and in addition to. And what we've seen kind of as a result in these subsequent 2 years since is almost like this growing awareness throughout our regions and this broad regional response to this grant making, and from our grantees as well, of this almost shift in thinking from singular projects to broad, almost movement building. And it is incredibly, incredibly exciting. And I'll kind of leave it at that.
And we'll hand it back over to Bobby.
Thank you so much. I think that's a terrific place to begin our conversation. We can take the slides down and just have an open discussion. And I'll say again to everybody in the audience, we really want to hear your questions too. So put whatever's on your mind in the chat. If there's things that you heard that stood out, you want to hear more about them, or questions from your own work that you want to raise into this discussion, we'll keep an eye on the chat. And but let's start with the place that you ended there, Caitlin, of the idea that and the title of this is Beyond Programs, right? And the idea that an investment can sometimes be an end unto itself, or it can be the catalyst for something bigger, a cultural strategy, a movement. So what are those signs that each of you are looking for that tell you that this is bigger than a program, that there is something moving around the relationships and the resources that are flowing in different ways here? So what are those things that you're looking for that tell you that you're on a positive path here? We'll start with you again, Caitlin, and then we'll go whoever else has a thought on that.
So I'd like to give a specific example of a project slash program that we just had recently kind of come to fruition and kind of come to completion. That started out as a rural effort that was to build and kind of invest in like a singular standalone shelter facility for unhoused folks. And that was sort of it at the very beginning. But what ended up sort of happening around it was really phenomenal. What began as just sort of this standalone project, as they were going out to it, kind of going out for it, they rallied a lot of support in the entire region. And this was in Southwest Ohio. They rallied so much support that the person who was going out for it ended up creating an entire coalition in the region that was focused around the issue of unhoused folks and how to create a response network that's tailored to their needs. So she created an entire multidisciplinary team in that rural region in Southwest Ohio, spanning multiple counties, in addition to this project. Beyond that, she ended up coordinating the first place in time count for that county that had taken place in over, I want to say, over a decade. I'm not sure if it's been 20 years. But due to that, that county can now actually apply for more funding at the state and I want to say federal level, because previously the last place in time counts had maybe counted 2 people who were unhoused. And they knew that it was a lot more. What has ended up happening, apart from just that single facility, they have now coordinated a second site that they are hoping to turn into a multi-practice site with multiple folks who are not just providing services to unhoused folks, but they're also hoping to do therapy, on-site medical facility, on-site daycare facilities for folks who are parents. So it's beyond just the singular resource. They're hoping to do a secondary resource that's for children and families too. So it has evolved beyond just kind of the one effort into this entire movement that's in response to the needs of unhoused people, and it has shifted entire attitudes towards them in this region.
Huh.
So that's kind of what we mean when we say that looking through this looking through this lens and kind of changing culture and this shift that the language and this movement building kind of grants us.
It's a lovely story because on the surface, the vital conditions doesn't dictate or prescribe any of that, but in the hands of good organizers, in the hands of people who really understand who they're connected to, who they want to be connected to, who's falling through the cracks, it ends up being something bigger than anybody or any grant architect could necessarily have predicted. So it's a lovely story. Um, uh, Duffy, Marivel, what are the signs that tell you that this is bigger than a program, bigger than a project or a single kind of grant?
I was pausing to see if Marivel wanted to jump in.
I want to say that we're shifting perspective and we're planting seeds on how we're really looking at belonging. And so I think that that's a marker. I think for me and my perspective where I'm coming, movement building and just all of the grantees, if we're able to actually look at ourselves within this framework, this is a win. Because then we're going to start looking at how we're actually helping our communities and helping our neighbors. And I think that is incredibly powerful, and bringing all of these people, these leaders to the table and bringing community members into the table and introducing the framework, I think is a marker for me, I think. But Duffy, I don't want to.
Thank you. I just I think one comment on just the vital conditions in general is, we found that community they just get it. They understand the vital conditions framework. And when we spend time, and we spend a lot of time in a lot of different spaces, and it's not that our systems folks don't understand it. As individuals, they understand it, but as a system, those are really big boats to turn, and the bureaucracy layers, et cetera. And so, that was one early learning we had. As we introduce this, the CBOs and neighborhoods and communities that are organizing are like, oh, we get this. This is what we live all the time. So I just wanted to point that out. And I think one thing of like where it's catching, just a quick story. We've had two large summits in our county. In our first summit, we had about 150 people, and it was just such rich dialogue. The stewards who work with the program, it's really their relationships with the community that sort of builds the trust that's needed for our community members to join us in some difficult conversations, and we need to create brave space for that. And then in our second annual one this past April, there were about 260 people, and we had tripled the size of actual community members that showed up. And that was both a testament to our stewards, because they obviously aren't going to use their voices to bring people in unless they're really darn sure they feel like it's a safe space and a brave space for them, which we saw happen. And we also were able to see a large contingency of youth. We've been highlighting youth all along, but there's now a school in an eastern part of our county that has actually raised up the vital conditions framework as an entire curriculum for a group of their students who are called the wellness. I always call them the wellness warriors, something like that. And for that to catch is really big. And I think I'll just end with, and there's one additional large initiative I'll just mention in our county that's around prenatal to age 3 early childhood. And the foundation is also the fiscal partner in all of that work. And they have chosen to join as a cohort, and they're using the structure of Contra Costa Together, which is really the intention that it's an asset for the region, and a network of networks to both use the framework and leverage all of the relationships across the county, because it gives us a way to align in a very different way in our region than we have. Because everybody, if you sit down with one CBO, you'll hear the same thing. They call us the land of the coalitions, and we've had to work hard to say, well, this is not just a coalition. This is a group of people trying to very intentionally connect and lift up all the work that's happening across the county in a way that we can align and accelerate all the work that needs to happen. My last comment is, I know we're no different than anybody else on this call, and what we're getting ready to have to walk through with all of the big, beautiful bill changes that is tearing our safety net apart is extensive. And the feeling is to go into crisis mode, which, yes, will be necessary. But in terms of ensuring that people thrive, and thinking about the slide that Bobby shared in the beginning, and who's thriving and who's not, this is such important legacy work, and we can't urgent service our way out of it. And watching that notion, as soon as we start talking about that, everybody understands that. We don't yet know how exactly that we're going to what the actual innovations are, but we sure know when systems fail, communities rise. And that is also something that there's a lot more discussion about across our county that we haven't had before.
Can I add something real quick?
Yeah, please go ahead.
I was just going to add too, because I see that there are a decent amount of foundations on the call too, that I think, and you asked of like the signals of change and stuff. I think that what you're asked to do looks different. And so, Duffy, I think your example calls it out perfect. People need space. And so I think as philanthropic organizations, we have to orient ourselves different to like what success looks like. And so we have an analogy that we like to use of a rest stop. We're a rest stop. What do people need? If you need resources, if you need a spot to rest. And so I think it's really important to orient yourself differently to the impact that the community is actually doing the work that they're doing, and really leaning into what is your role as a foundation to set that container, to give those unrestricted dollars to shield and protect. And so I think that that is extremely important when we're thinking about the work, because then I think you talk about success and impact differently. But that's something I wanted to just make sure I called out.
Yeah, let's talk a little bit more about that. How does the experience of the relationships and the energy that you're all of you have said that these, the innovations in grant making didn't just start out of nowhere, right? They're coming out of a set of different kinds of conditions that you're setting up in advance. But what does it take to institutionalize that as a different kind of grant making? That part isn't a given, and there are questions here about how even small foundations could get their start into this work. So talk to us a little bit about the inside game within your own institutions to say this is not business as usual. It really is a chance for the grantor and the grantees to start doing the things that maybe they've always long wanted to do, but one or another was creating constraints. And it seems like you're clearing away some of those constraints to allow something much more energetic and human to shine through. But let's talk a little bit about the inside game. What did you have to navigate to be able to establish grant making structures that match the kind of relationships that you wanted to see happen in the communities?
I'll mention something really quick. I think what was key to us and what has remained really important is, as Caitlin mentioned, handing over the decision making. Because people want to come back and say, well, I'm like, well, we don't have a say. And so I would say, and even in that, there was a lot of unlearning that had to happen with our council too, of non-equitable grant making practices, what people deemed a worthy application. And so we saw the first round like, oh goodness, we would have chose that, but there was nothing we can do. And so I think as much as people can hand over decision making, to those closest to whatever issue or thing that's being addressed, I think it is extremely, extremely important. And I think too, and I gave a kudos to Caitlin before, I think the people that are leading the work have to be really invested in the work and in the communities that they're working in. And so those are just a couple things that I'll mention.
That's nice. Others?
Yeah, I would I would say ditto. In terms of, it's really about learning. I mean, first of all, this work moves at the speed of trust. Absolutely. And there's times where we can move more agilely, use more agility. And there's times where we really just have to wait until the community's ready in those conversations. And I think that it's just mirroring what Ashlee said. It's so important that we had to rethink, not only as a foundation, but even as CBOs around how do we make decisions and how do we trust how those decisions are being made. And in the grant process, it was not, it was a group of stewards who had to make a decision around how to spend some of the grant dollars. And they were clear almost from day one that they wanted to ensure that the dollars went to the community. They didn't want it going to any systems. They really didn't think it should be going to CBOs that always are at the front of the line to get a lot of the grants. It needed to go to community. And that is what it did. And that it also needed to have community voice as part of the decision makers, and that process happened as well. That was crucial. And I think that, I'll just mention one more thing real quick. Capacity building is such a key piece that is woven through, because there are a lot of things we need to unlearn and relearn and really think about how we reimagine how the work happens and how resources are distributed.
One of the things that's so striking to me is that, these are relatively well-developed examples insofar as, the processes have been unfolding and you can see how resources are flowing in different ways. But it really is a whole different cast of characters that had to play different roles along the way to make this happen. And Marivel, I'm remembering one of the things you said in your opening comments about wearing multiple hats, right? The co-founder of a new organization, as well as a steward of Contra Costa Together, and how are we going to think and act differently? So can you just talk a little bit about the roles that you and others here have been playing that told you that this was, no kidding, this was a chance to do something different and maybe, more meaningful?
Yeah, I really appreciate that, Bobby. Being a steward, there's a lot more responsibility that comes in with that, because I'm not just thinking about the mission of my organization. I'm thinking about the mission of our community in general. Where are we? How are we meeting the mark? And so when we're making those decisions, it's not just the decision of HDC, Hijas Del Campo, which is incredibly important. But if I'm going to move them forward, I need to figure out how we're going to be making space and of very thoughtful movements to making sure everyone in our communities are being seen and heard. And, that was crucial to me. I mean, one of the things that I can look at is the industrial prison complex, right? It's heavily affected our Black community. And we're also looking at, the juxtaposition now of like the mass incarceration that we're seeing through the current administration, right? Where were we and how have we been showing up for that prison industrial complex, and how it's been harming our Black community, and how is this time we're in right now, harming, our Latino community, but it's not just a Latino issue. So you have to make sure that when you are a steward, that we are looking at all of these things. We're looking at solidarity. We're looking at how we are truly fighting for each other. And what does it mean for us to belong? And so that's not just wearing my HDC hat and as an executive director, as a co-founder, that's making sure that I'm wearing the hat of like me, Marivel, who I am, how I grew up, what my integrity is, and what I want to see in general for everybody. And that means everybody thriving. And what does that mean? And how do we actually meet that mark? And how am I listening to others to making sure that that does happen? And so sometimes we do, like Duffy mentioned, we have to slow down because everybody's just like, go, 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 go. No, like we need to understand, what are these fights? What are the struggles? What are the other lived experiences that are not mine, but that deserve to have their voices heard and have a seat at the table? We looked at what happened this morning with this. I keep going back to the Supreme Court, but what happened today with trans rights? Who is at the table representing that, right? And so as stewards, we need to make sure that we're also thinking about all of these things, because if we're looking at truly what does the vital conditions mean to us as stewards, then how are we uplifting everybody's voice in that thriving space, while also making sure my farm workers, my families have what they need, and that the normal folks who are in positions of power because of white supremacy and the power dynamics that have existed in a lot of Contra Costa for many years, it's that political structure that we're looking at how we're actually breaking that down and rebuilding it in this new way where vital conditions are being taken into consideration.
It's such a rich answer you just gave there, because you sort of took us on a tour through all layers of this ethos. You want to thrive together, you got to get busy working on vital conditions. If you're going to do that, you got to start thinking differently about yourself in relationship to others, the solidarity that says nobody left behind, no exceptions. And that means investing differently, working differently. So this ethos is another reason why, grant making takes on a different complexion in this work. I'm thinking is because it's not just the transfer of resources, it's really bringing in those relationships, working relationships that all kind of bring that ethos to life. What about Cincinnati? How has this been shaped by the human beings, right? Caitlin, you were introduced by Ashlee as a phenomenal person doing a phenomenal thing. So, how have the people involved helped to shape what the Rural Changemakers grants have become?
Well, I think it's kind of a two-part answer there, and it's like a it's like multifaceted, because you can't really separate the grant making from the community from the council, because we're very intentional with the way that we go about with recruiting the council, it's the accent, with recruiting the council, with how we train the council, with how we go about with very intentionally putting forward the Rural Changemaker grant itself, because we want to not only create that same culture shift and create those same outcomes that we want to see in our rural region. We want to be intentional across the board. And we realize that that is, especially in our political climate right now and in our particular area, at times that is no small task.
Yeah.
When it comes to our council, we want to be very intentional with how we are training folks and bringing folks on, that we are bringing folks on that are reflective of the community that they live in, and that also are reflective of the values and ethos that Interact for Health brings to the table, and also come with an understanding of what we are trying to accomplish with the Rural Changemaker grant. which
Mhm.
is in fact to create this broad systemic change in our rural regions that is not only based on the vital health conditions, but to create these broad systemic changes to create a better world that is rooted in that solidarity that Marivel just spoke to.
That's great. Um, we're coming to the end of the hour. There's going to be 15 minutes of like really informal, open conversation, so others can chime in with their own voices. But let me just ask a final question, which is, on today's call for time, we've really spotlighted a couple examples, but and my understanding is you got a lot of applications in both cases to this request for proposals. So what stood out for you in terms of the other applicants, the size and complexion of what people were proposing of doing, and what does that mean for the kind of work that you think will unfold over time here in both places? And it could be from any of you who are looking at the the variety of applicants, the ones that were funded and even the ones that weren't.
I'll chime in. I'll just say, and this piggybacks off what Caitlin said a little bit. I think that we see, again, our council is the one that are making the decision. I think over time, you hear the conversations around how connected is this organization? How connected are the people to community? Do people know about them? Do we really need another, like assessing like the needs that are being brought forward? And so I really appreciate that dialogue that we're seeing happening during the discussion. And it's based off of the criteria, but just the intentionality of calling the question around how connected is the work to people in the community who brought up this issue? Is it a valid issue? I really appreciate that. And then a lot around metrics too. I think the council has really evolved, and I think there is an appreciation for the more systems change work and what that looks like from a metric perspective. I would say early on, a lot of folks were, oh my gosh, how many people, how many people? And we're like, oh, no, it's not what this is about. They can have 5 people if it's a great work that people deem important. And so I would just think about what we're seeing is so over time, the difference in how people are thinking about success and then also the intentionality of the council in assessing the level of community involvement in the community presenting this ideal. And also, we have a lot of organizations that are Cincinnati based coming to rural communities in some instances that people are applying for. And so they're very intentional about do they even have a presence here? Is this a money grab? And so I really appreciate just the intentionality that the council has taken with those areas.
Oh, that's lovely. Duffy, what are you seeing in the signals of the applicants, and what do you think it means for the kind of work that can unfold over time?
Great question. When we put the grant call out, we did not have a huge amount of money. We started with $200,000, which is definitely something. And we were, expecting a good amount of applications. But what happened was we had $200,000 to grant, and we had over $2.2 million in asks. And, on the one hand, of course, it's not all that surprising, just in terms of the need that we see across our county. And it also was surprising where people were the part of the application. We always try to design the applications in as easy to complete as possible, but also getting the information back that the committee has deemed really important. And everybody had to describe what it was they were going to focus on in terms of the vital conditions. They didn't need to do all of them, but they needed to call out a minimum of 2. And Marivel as a grantee might have more insight into what it was like on her end and looking at that process. Um, but it was a fast, and we got introduced. The thing, let me prioritize. I think the thing that was most interesting is one, we learned about organizations we had no idea were out there, because the way that this grant was shared was different than other grants that we've done, just because of the process of being part of the stewardship team in Contra Costa Together and those networks expanding. And we were seeing in real time the impact of that and hearing voices that we had never heard from before. And we also have included any grantee, anybody that applied for a grant in the vital conditions framework lens was added to the work we're doing. We invite them when we're having sessions. We want to be sure they're included. We do lunch and learns for the grantees, and we have found that people are really interested in coming together, not just doing their grant work, although they'll be the first to tell you they don't have the time, but they seem to find the time because it's important to them to really deeply understand how this work's being done. So I hope that answer was helpful. Marivel, I'd love to hear your perspective if you don't mind.
No, no worries. Thank you, Duffy. I think as sitting on the side of the grantee frame and hat, what was really interesting going through the process is how many of our organizations were doing some form of work that was within the vital conditions, right? But then seeing us within that wheel and what we are trying to answer, I think was a very interesting process for us. And I think the other thing is the trust once the grant was given, right? It was the trust from the organization, I think from the foundation to say, you are the expert in your community. We trust what you've written and do your magic, right? Make your magic happen. And I absolutely appreciate that because sometimes as grantees, we have to jump through incredible hoops with a very small team. So reports, what that looks like, how detailed it has to be, it takes us away from having to do the heavy lifting, the emotional lifting that we need to do on a ground level. And so that is something that I am incredibly appreciative about. And I know that the other grantees are appreciative too. And I think also as a grantee, also being able to see who else in our county is doing some of the work, right? Thriving natural world, right? We see that in a lot of our communities, we don't have parks, right? We don't have access to these things. And so then seeing organizations that are doing that, how can we pull you into our neck of the region, of the county? And so that was a great process. And working with Duffy and the team at the Regional Health Fund was phenomenal and really supportive. And I should say, we did not know who was a part of the decision-making process. We knew it was community members. So that was really helpful too, because we knew our project was chosen in a way that was very careful. Yeah, I don't know that
Yeah.
is helpful.
Well,
No,
and just one quick thing was how helpful others that have been doing the work longer than we had, and just building those networks and reaching out and reaching out to North Sound. I see my colleague Liz Baxter on the call, and watching what they were doing in the Inland Empire was an important learning piece for us, and how you do this work.
That's a good segue, that whole last exchange. I'm looking at Letitia's question. Letitia, if you're still with us, you were asking about governance. And, to some degree, we've heard a little bit about who gets to make the decisions and how trust is extended here. But maybe if you want to share in these last sort of open 10 minutes about a little bit about what's behind your question on governance, and did they answer it, or do you have more in mind here?
Yeah, I think I got components of it, but really what it is, as you're talking about this opportunity to really utilize the presence of foundations and grant makers to support opportunities to be, I guess, more systems oriented and utilize metrics to measure impact, if you will. In my community, I kind of feel like I play this role where I'm a consultant. I have a lot of policy background. I have, program background, but it's happening in my backyard, like it's in my home, in my community. So I come in with a hat of kind of like what Marivel was saying, like I have this hat of this and I have a hat of that. Um, and they are at the phase where they're developing governance structures for themselves and they're talking about like, what does this look like? But the group continuously echoes that they want a flat structure. They don't want hierarchy. And interestingly enough, the group has moved in that direction to try to create a flat structure, but inherently they keep going into the hierarchical structure. So it's almost like something that was built and it's like in the fabric of people's mentality. So how do you break from that? How do you like push against something that has been ingrained into our systems and our way of thinking as well? So if you all could unpack some of that, that would be so fascinating. But again, I continue to operate in this place where I'm like, I know what the systems like are like because I've worked in them or I work in them, but I'm also a community member and I'm also pressed because I'm like, it shouldn't be that way. So it's a dilemma. But any insights would be appreciated.
I just want to jump in and say the, it's work. Like you got to put in blood, sweat, and tears sometimes because we are so ingrained to work in that framework, right? And even those from community, right? It's we want to have that structure, and it takes a little bit of time, especially, when we're working with systems. It is so slow when you're working with some government systems because of that same hierarchical process. There's a lot of patience that I think that comes with it, but maybe Duffy, if you can add a little bit more. But yes, I just want to say I feel your pain.
Yeah, it's a long process for sure. My comment, I'll make a brief comment around part of the decision making very early on was to create to have a backbone that also our county health department was part of, as well as we had a new county agency lifted. That's the Office of Racial Equity and Social Justice, and they too are part of the backbone entity. And that was really important, in addition, obviously, to the stewards, because we need the systems to be there, and we also understand that there's so much work to do across the systems as well. Not only is the stewardship team building trust together over a 2-year period, the systems are having to do their own work around, you know, is this the work that we're doing? Is this how we're going to invest? How to, and then recognizing that they're the exact same set of challenges within all of our systems and the healing that's needed. And so the layers, I'm not saying that to be overwhelming. I'm saying that there are so many layers and that there is a way to just name it, recognize it, and start doing the shared understanding around that. That was a crucial part of some of the work we did together.
Mhm.
That doesn't mean it's all easy every day. It doesn't mean it gets easy, but it is a deeper way of connecting uh, with authentic, with more authenticity.
Um, Any other thoughts on that point? There are a handful of questions that are really about measurement, and we've talked about that throughout this call and the signs that pay attention. How do you know that movement is, building? But is there any other thoughts about navigating these cultures of what are the ways of making the curiosity about where this work is going? How far is it moving? How are leaders themselves changing in this work? There are many people in the audience are I'm just reading between the lines on a number of questions here that are about the innovations around measurement that travel along with these innovations in funding. Ashlee, that might be a good question for you. How those conversations play out um, in your work?
Yeah, a couple things come to mind. I think, like I mentioned before, I think we recently have just been thinking about like our role and what that looks like, and if we are able to, like, how do we set our grantee partners up for success? We have worked with some of our grantee partners, not particular in our rural investment strategy, but in some other area around journey mapping as well. And so having folks just tell us the journey that they want to be on with us. And I think not even with us, just their community. And then having them let them tell us what does it look like over a period of time with different checks in, but not punitive, if that makes sense. And so I think going back to a lot of that unlearning. And so it's been hard because people are like, well, what do you want us to do? I'm like, well, whatever y'all want to do. I don't like, what does the community need? We'll figure out how to talk about it and how to package it up for a board conversation, but you just do the work. And so I would say that we've just been on this journey of being able to, one, communicate the change that the communities are elevating, that are important change metrics to them. And then I think that we have not, and I wrote down because we've taken the stewardship assessment as an organization. I was like, oh, that is a tool that we should probably be using in some other spaces as well. But I think that that is an excellent tool to pair with some of these things. And so I would say that we're on the journey and we're trying to be very intentional about giving people a long runway. I think a lot of times with this work, people want to see 10-year, 15-year outcomes in a year. And so we just tell people you have to be patient. And like we're a lot of this work, we're at year 4 and 5. And so we don't have the outcomes that you want to have. We're going to synthesize all of the information at the end of this time. And there's going to be some great stuff there. And there's already signs of progress. I would say, like, we see people that have joined councils and kind of disrupting existing power structures. And so I think that, it's really some unconventional ways of thinking about success. And it's not from our point of view, which is very different than what we are used to, one, communicating to folks. And people aren't used to engaging with us with that perspective too.
I love that. I could have this conversation all day long with you and the others on this call. But just in terms of wrapping up today, I think you've given us a really meaningful metaphor here to go instead of, a program that delivers an outcome at a certain price at over a certain time. This is really about an investment to move in a certain direction. Nobody knows exactly how far or how fast it will go, but we do know, and Marivel said it right at the top, we know what it feels like for belonging to be stripped. And we can see what it looks and feels like for it to be built. And we can know whether resources are generating more and more momentum, whether the meetings are getting bigger over time, not smaller, or the strongest effect of most programs is at the moment that the assets are given and everybody gets organized, and then maybe they were just in it for the money and the thing erodes over time. But movements work differently. Investments in people and connection and community work differently. And so the kind of directionality that the vital conditions ethos, the thriving together ethos gives us, puts us on a relentless path to move in this direction. And the resourcing that you're doing here, is a big part of why we and so many others feel like we can make great strides. If, just imagine if, scores of other communities across the country even take the steps that you've already begun to take, and they can learn, unlearn what's standing in the way and learn a little bit from the positive moves that you've made here today. There's no reason that we couldn't make significant strides and look back in a decade and say, it was because we started to put, our humanity in the foreground and bring our resources to each other rather than, a dozen different programs and projects that are all somehow supposed to add up to a better system. I am so thankful for all of you who've attended today, for the work that you do every day. There is a feedback form. We take it incredibly seriously. So Amanda, why don't we put that in the chat one more time? If you have any thoughts to share with us about pros and cons or what you'd like to see in future sessions, our door's open on this, and it's a big journey and we know we can make great strides. So thank you for everything today. We'll hang on for a few minutes if anybody has something they really need to say, but this 75-minute tour through the frontiers of grant making is really left me feeling a lot more optimistic.
I'm energized too.
Duffy, Marivel, Caitlin, thank you so much for sharing your story so generously.
Thank you.
If there's ever a time to keep hope alive, it's now.
Right. Yes.
Grateful for all of you. Thank you.
Yes.
Yeah, we're getting lots of love in the chat here. Thank you. And to the Ripple team, thank you for helping to put on yet another one of these sessions. We love doing these with everybody.
Mhm.